If you brush every day and your gums still bleed, listen up. This is not normal. Hi everybody, I'm Dr. Hormonal, dentist, and today I'm going to share 9 hidden reasons why your gums bleed. Reasons most people have no idea about. Gum health is just as important as tooth health because your gums are the foundation that hold your teeth in place. Let's start with the first one. Plaque and tartar buildup around the teeth, which is one of the most common causes of gum bleeding. The real problems begin when we misinterpret this bleeding. When people see their gums bleeding, they usually think, I don't brush well enough, so they brush harder, choose a stiffer toothbrush, or apply more pressure for a longer time. But that actually makes things worse. Brushing harder doesn't help at all. It weakens the gum tissue and increases inflammation. So what should you do? First, always use a soft toothbrush. Your gums and teeth are living tissues with limits. They are not dishes or cloth, or the harder you scrub, the cleaner they get. In fact, brushing too hard causes damage. Another very important point, you need scaling to remove tartar around the teeth. If scaling is done properly by a dentist, it doesn't damage the gums. On the contrary, it reduces inflammation and helps restore gum health. Reason number 2, high blood pressure. Bleeding gums can actually be one of the early hidden signs of hypertension. When blood pressure is high, the walls of the tiny blood vessels in the gums become fragile. As a result, even mild stimuli like brushing or flossing can cause bleeding, even when there isn't severe plaque buildup. Many people have high blood pressure and don't even know it. The gums can be one of the first places where the body signals that something is wrong. Blood pressure medication can also cause dry mouth. Dry mouth means reduced saliva, and saliva plays a protective role. When saliva decreases, inflammation increases and bleeding happens more easily. So when should you suspect high blood pressure? If your oral hygiene is good but your gums bleed for no clear reason, if the bleeding is chronic, and if it's accompanied by symptoms like headaches or heart palpitation, you should definitely see a doctor and check your blood pressure. The third reason is often overlooked. Stress. Stress doesn't just affect your nerves, it directly impacts your immune system. With chronic stress, cortisol levels increase, and this hormone reduces the body's ability to control inflammation. The result, even a small amount of bacteria can trigger a strong inflammatory response in the gums. That's why many people with high stress lifestyle experience gum bleeding despite having good oral hygiene. Reason number 4, diabetes, especially type 2. This is one of the most important hidden causes of gum bleeding. When blood sugar remains high over time, the immune system becomes weaker. Here's something critical to know. The relationship between diabetes and gum disease is two-way. Chronic gum inflammation makes blood sugar harder to control, and high blood sugar worsens gum inflammation. This creates a vicious cycle. If it's not broken, both oral health and overall health suffer. That's why bleeding gums in people with diabetes are not just a dental issue. They're a serious warning sign from the body. So far, we've seen that gum bleeding doesn't always come from the teeth themselves. Now let's move on to reason number 5, nutritional deficiencies. Vitamin C is essential for collagen production and healthy gum tissue. A nutritional deficiency can make blood vessels more fragile and increase bleeding. Vitamin B12 plays a key role in nerve health and tissue repair, and a deficiency can worsen gum inflammation. Deficiencies in iron and vitamin D can also weaken tissues and increase the risk of bleeding. Many times the problem isn't your toothbrush. Your body simply doesn't have the nutrients it needs to repair itself. The next very important cause is medication use. Some medication directly increase gum bleeding, such as aspirin or warfarin, certain antidepressant, anti-seizure medications. These drugs don't necessarily cause gum disease, but they lower the bleeding threshold, meaning the gum bleed with minimal irritation. Reason number 7, which often gets ignored, is hormonal changes. In some people, especially women, hormonal fluctuations can increase gum sensitivity and cause bleeding, even without heavy plaque buildup. Once hormone levels stabilize, gum tissue usually return to normal, so don't worry about it. Reason number 8 is dry mouth. Dry mouth can be caused by medications, mouth breathing, smoking, alcohol consumption, systemic diseases, or stress. Saliva has a crucial defensive role. It cleans the mouth and helps reduce inflammation. When saliva decreases, bacteria grow more easily and the risk of inflammation and bleeding increases. And the last reason is blood disorders such as platelet disorders. When the number or function of platelet is lower than normal, the gum can bleed with the slightest stimulation. This condition is usually accompanied by other symptoms such as unexplained bruising on the skin or prolonged bleeding from small cuts. Now let's answer the most important question. What should you do? First, brush more gently and more consciously. Excessive pressure is the enemy of healthy gums. Use dental floss. If your gums bleed when you floss, don't stop. Bleeding is a sign of pre-existing inflammation, not that flossing is wrong. Take a look at your lifestyle, sleep, stress levels. All of these affect your gums. A proper diet includes dairy products, vegetables, and adequate water intake plays a major role in wound healing and reducing inflammation. And finally, if gums bleeding lasts more than 2 weeks, even with good oral hygiene, this is no longer a simple issue. Don't skip your regular 6-month dental checkups. Healthy gums are the result of overall body balance. So when the balance is disrupted, the gums are often among the first places to react because the mouth isn't just a part of your body. The mouth is a mirror of your body.